of the Portfolio Committee on Health. It is a meeting that started this morning at 10 a.m. We are about to receive a presentation from SAHPRA on the APP and budget, and we will have an engagement with them. We've had an introduction, or yes, let's call it an introduction by Dr. Semete, of who is here from their team. And so, Dr. Semete, we will go straight over to the presentation.
Dr. Jacobs. Yes. Sorry, I had some difficulties joining. I'm in DC. I had some difficulties. Sorry for being late, but I'm here now. Apologies.
No problem. Just welcome to all of you. So I'm going to hand first to you, then Professor Rees, to give some introductory remarks, and then to Dr. Semete, and we will continue with the presentation from there onwards. Thank you. Can you unmute, Professor Rees?
Yes, thank you. As I say, I had some problems just linking. I'm attending a papillomavirus meeting, and I think at some point it would be very good to have a discussion with the Portfolio Committee on where we are with the HPV vaccines. But putting that to one side, thank you very much for also changing the time and facilitating this discussion. As we know, SAHPRA is a key pillar for public health, and it's going very well under the leadership of the CEO and the executive team and all the staff, but it's not without challenges. As you'll see, there are many areas that we still have to reach out and cover, which would be a priority for this year. We're obviously very much part of the cannabis discussion. We are looking at radiation devices and talking to on the nuclear side as well with the regulator there. We're also looking at more again at medical devices, and that will be a priority. So there are big areas that we still have to look at, which will be picked up in the discussion now. But you know, it's definitely it's going very much in the right direction, and I think we have said this to the committee before, that it's got unqualified audits, and it's got also this recognition from the World Health Organization, what's called a maturity level 3. And just so we know, that's very important, because many other African regulators are seeking that kind of recognition from WHO. And on the basis of the strength of your regulator, that will also contribute to determination of investment in the manufacturing of medicines, vaccines, and so on. So the regulatory authority and its standing with WHO will be very important for future investments. So this is a work in progress, but a good work in progress, I think, from the point of view of the board. I'll stop there. Thank you very much.
All right, Doctor, thank you very much, Professor Rees. Dr. Semete, you may continue with the presentation.
Thank you, Chair. I just need to be enabled to share my screen. It says host disabled.
All right. I'm sure that the support staff has just heard you. The host, can you please support?
Okay, I'm sharing now, Chair. Okay, great. Seems you can see the slides. Great. Thank you so much, members, and thank you again for having us. Today will be, as per the request, we will be sharing on the revised strategic plan for the period of 2020-21 to then 2024 to 2025. And we'll also be sharing the annual performance plan for the financial year that just started now in April 2022. So these are documents that are looking forward. I do anticipate that after the audit by the AGSA, you will certainly be calling us to give you a presentation of how we've performed in the prior year. So I'll give some introductory remarks. I'll talk to some of our pillars, and then I'll spend some time on the actual strategic plan, the annual performance plan, and we also have our CFO who will take us through the midterm expenditure framework budget. Chair, just to say that SAHPRA, as a health products regulatory authority, we remain an essential component within the health sector to ensure access to quality and safe health products for both human and animal health. So the work that we do spans both these areas. So some of you may have heard about antimicrobial resistance and some of the challenges in there from an animal perspective. We are involved in that together with the Department of Agriculture under Act 36. Secondly, as we grow, we're now in our 5th year operating as a Schedule 3A public entity, having been transferred from the Department of Health. We continuously work towards ensuring that we deliver on our mandate, which is around monitoring, evaluation, regulation, investigation, inspection, and registration of medicines, as well as all health products, including medical devices. In addition, we do have oversight for clinical trials, which is an important area, and I'll talk to that in the next few slides. And again, as Prof. Rees has alluded to, the area of radiation emitting devices is under the ambit of SAHPRA. So our mandate and our scope is quite broad. And as we do so, we work towards ensuring that we focus really on our core mandate of safety, quality, and efficacy. This is the composition of our board. We have Prof. Rees and Dr. Obakeng as the chair and the vice chair respectively. We have members who were reappointed from the previous board and those who were newly appointed. And this is them also on this picture that we have here. Again, you can find this on our website. There are a number of legislative acts and bills that are quite important and we consider all the time when we make regulatory decisions. The first being the Constitution of South Africa, the second being the National Health Act. There are elements in the Act wherein SAHPRA does provide support to this Act. A very important Act is the Medicines and Related Substances Act, as amended in 2017. And really it guides how we do what we do as a regulator, as I spoke earlier, from product registration to investigation of sites, licensing of those manufacturing sites, clinical trials, etc. And we have, Chair, started a process of overhaul of the Medicines Act. And in the next coming months, I'm sure we will be coming to the Portfolio Committee through the Department of Health to take you through that. The core elements really that we're changing in this Act is because it's been amended so many times, there are some sections now that when you read them, they just don't make, are not very coherent. Some of them, they are open for, different interpretations. And we've seen with some of the court challenges that we have. So really, we're not changing anything fundamental. We will remain to focus on safety, quality, and efficacy. However, it is the details around that we will be amending. The next set of acts is the first is the Hazardous Substances Act. And this is an act, again, that will be once we finalize, the co-regulation model with the national nuclear regulator. This is an act that would also need to be amended, and it enables us to provide effective and efficient evaluation and registration of facilities and products that are non-ionizing radiation emitting devices. So this is the likes of your radiopharmaceuticals, of machines such as X-ray machines, etc. And as I've alluded to earlier, there are other legislations that do impact on what we do and how we do it, but also we partner with the custodians of these legislative frameworks. For example, on the Drugs and Drugs Trafficking Act, I just came from a meeting with the Department of Agriculture, Department of Justice and Correctional Services, Department of Health, and ourselves, where we were discussing cannabis and the bill for private use of cannabis. So again, a very important act that we consider as SAHPRA. Another important one is around the Pharmacy Act, which we work very closely with the Pharmacy Council. And I've also made reference to Act 36 that it resides within the Department of Agriculture. And with the number of these stakeholders, we have some kind of framework that enables us either to co-regulate or to engage and ensure alignment. And at the core, Chair, of what we do, we focus only on safety, quality, and efficacy of the products that we regulate. So with that introduction, I'm now going to spend a few minutes taking you through the strategic plan. As I said, this is a presentation that's looking forward. The strategic plan was submitted to the portfolio committee through the department, and we presented on this around 2020-21. However, as per the DPME framework, we make amendments annually. So the main amendments that we've made or revisions are on our outcome indicators, our 5-year targets, and method of calculation of our descriptors. Okay, and we've shared a detailed document to this, so the presentation, it's to aid the discussion. So in terms of our outcomes, we will continue to focus on effective financial compliance and performance management in that our 5-year target, which will be for 2024-25, is that we would have a clean audit opinion obtained for the 23-24 financial year. The matter of financial sustainability is quite important, and at the moment we do monitor that, and we'll talk to that later on as the CFO presents, in that we do as a regulator have to make sure that we're sustainable. At the moment, our revenue mix includes the allocation from the National Treasury, as well as the fees that we receive as we charge applicants for the work we do. However, we do need to get a lot more support, financial support from the National Treasury. We don't want to be in a position where we're heavily reliant on the fees that we charge. If you look at many regulators across the world, you have the state being the biggest contributor to their financial, to their revenue. And I think it is important that we try to strive towards that, because it enables us to achieve some of the projects even that I will talk to. The third one is around stakeholder needs. Again, we've seen this come through a lot with COVID, that we have to engage with a range of stakeholders, and I'll talk to you just now around some of the plans that we have around that. The next 2 KPIs, they talk to the internal environment within SAHPRA with our staff, in that we want to create a positive enabling environment. We conduct a survey, and based on the outcome of the survey, we will then intervene, implement whatever interventions. And quite important is to be able to attract and retain talent. And because of our challenging revenue situation, we are finding that a lot of the salary offers that we make are rejected because the external market that we're recruiting from pays much higher salaries than what we can offer. And so again, it is important that as we have the regulator that needs to support and enable the sector in the country, we need to make sure that it has the right skills and those skills at the right capacity. And being able to then offer competitive salaries becomes quite important. From a regulatory perspective, our 5-year target was that we would have cleared the backlog, and we've been able to achieve that. Any backlog with variations, we've been able to achieve that, but also to make sure that any new chemical entity, so this is the likes of vaccines, any new drugs that we don't have in the country, that we start to reduce the time that it takes for us to arrive at a decision as a regulator. And so this is something that we will continue to monitor. And it's quite important because, again, these are new chemical entities wherein there is no other alternative, in the country. And as we do what we do, complying with global best practices is important. As you may be aware, last year we got maturity level 3 from the WHO. We're one of the 5 countries in the continent, but we're already starting to work on IDPs for maturity level 4 and even a to be a WHO listed authority, because once you receive that level, the WHO can even rely on the work that you have done. So as there are conversations around vaccine manufacturing locally, medical devices manufacturing, therapeutics, when these products are evaluated by a well-renowned regulator that complies with global standards, other regulators can then rely on what we do. And therefore, it is positive for industry, because when their products are exported, these products are trusted, and it reduces the review timeframes in other countries. The elements again on efficient regulatory practices pertaining to issuance of licenses for good manufacturing practices and good warehousing practices. Again, we will continue to monitor that. We want to improve our time that it takes to evaluate clinical trials. We saw how important this area is during COVID, in that for a number of the vaccines that we had authorized, they were evaluated in South Africa. So we had firsthand information on the safety, quality, and efficacy of these vaccines, because they were assessed in the country. Furthermore, around that outcome still. Sorry, the slide just repeats the previous one. So those are our high-level outcomes. And then just to go to then the annual performance plan for the financial year that started now in April. So this is what we're planning for. We have 25 KPIs overall. We are looking at, over time, continuously reducing this number, but because of the stage of where the regulator is, we're only in our 5th year. And so there are elements that we need to monitor and ensure that as the board effects its governance oversight, these are the elements that we regularly bring to their attention. But what I could say is that 68% of these targets relate to our core business, which is always a healthy kind of split to have between support-related KPIs and core business. So you can see we're still measuring largely what is our core business. And we've reduced these by 2 KPIs compared to the previous financial year. So just a bit of detail then on what are our targets for the year that just started now in April. The intention is that we will get an unqualified audit opinion for the 2022-23 financial year. The AGSA has already started with the audit, and we're working hard to ensure that we reach this target. I spoke about financial sustainability. We will continue to monitor that. We will be implementing a stakeholder survey this year. And when we do this survey, we interview a range of stakeholders, the public, healthcare, professionals, institutions that we work with, etc. And then we implement those findings and interventions. We will also be implementing a stakeholder survey with our current staff internally, because it is important that we address what their needs are and concerns are, and we continue to make sure that we can attract and retain talent. Training is an important element, particularly as we are employing new staff and there's all these developments from a technology perspective. We work very closely with the likes of the WHO to offer training for our staff. We do have vacancies that, based on the budget, as limited as it is, we're able to fill. But again, this is nowhere near what we need as an organization. And we're also trying to minimize the staff turnover. And one mechanism is to ensure that our salaries are competitive. And there's a big project that we have around digitization of the authority. Quite soon we'll be issuing a tender for our regulatory information management system, and this will certainly contribute towards making us more efficient. The second set of targets is around the time you see for this year, an ISO accreditation this year. Again, it speaks, very much to our compliance with quality standards. A number of us regulators, we strive to be ISO 9001 certified, but also in addition, we've started to work towards maturity level 4 by working on those development plans that will assist us to reach that. The next set of targets in our area of inspectorate and regulatory compliance is to make sure that we issue licenses in the stipulated timeframes. And one of the things that we've noticed since we've got SAHPRA staff who are present at the ports of entry is that we had a number of companies that were not complying with the regulations. And so we've issued communication. Those who have lodged their concerns with us, we've addressed them urgently, but it is important that every product that comes into the country, it is brought in by an entity that is a holder of a license, because we can then be certain that they are compliant with regulatory requirements, particularly since our borders can be porous. We need to ensure that only safe and quality products enter the country. We also issue permits, and the plan is to finalize those for within 20 working days. And also any non-compliance to the Medicines Act, when we get those reports, either through our whistleblowing facility that we have open to the public, or through other mechanisms that it's reported to us in, that we can finalize them within 30 days. Again, one of the important elements is to ensure that we increase our capacity over time, because we're getting a lot of reports of entities that are non-compliant with the Medicines Act. And it's important that we follow up on those and address those. In the area of clinical and pharmaceutical evaluation, our plan is to make sure that we continue to maintain the time frame for registering of those medicines that, or for authorization of those medicines that are not registered in the country, wherein on a patient basis, a healthcare professional will make a request to us to have that product authorized for that specific use. Again, we had a webinar with the South African Medical Association where we were taking the healthcare practitioners through what the requirements are, because we do find that at times there are delays in terms of the information that they've provided to us. And so at least we have a platform through summer to be having these webinars. Clinical trials, I've already spoken to that. We want to make sure that we evaluate within the target time frame. KPIs 18 is an important one. We saw with COVID that we had to play a very strong role in monitoring any adverse events following immunization. And our work is not only limited to COVID and COVID vaccine safety, but it's all health products, medicines, medical devices, etc. And to make sure that whatever report we get, we act on it within 40 days. And how we act on it depends really on what the report and the signal is about. But we plan to increase capacity in this area. KPI 19, while we are, monitoring the safety of the product, we also noted that there isn't a lot of awareness by the public on the fact that if they are utilizing a health product that is either giving them any adverse events or it doesn't meet quality requirements, that there is a platform on which through which they can report. So we've planned about 6 webinars, this awareness campaigns this year. We have infographics that are available on our website. We've done some videos in our indigenous languages, just to make sure that we reach, the population and create awareness around the fact that they can report these adverse events. And then KPI 20 speaks to the lot release. So whenever a vaccine, and this applies to all vaccines, not just COVID, all vaccines under our extended program of immunization, when they are then imported into the country, before, they go into anyone's arm, we test whether they still comply with quality and they still perform as they should. So this is a very important part of what we do. This is a function where when we are assessed by WHO, we reach the highest level, which is maturity level 4. So we've also been asked to assist other regulators like Rwanda, like Ghana, as they set up their labs to ensure that they can meet a similar standard. So we're definitely quite well renowned in this area. The last set of KPIs are around the area of medical devices and radiation control. Again, it speaks to licensing and the stipulated timeframes that once the regulations are published, we will be issuing a call-up notice for high-risk medical devices for priority therapeutic areas, and also to ensure that applicants who are offering listed electronic products, we issue those licenses in the required timeframes, and that as this is a new area that we're regulating, we continuously publish guidelines to inform industry in terms of what the regulatory requirements are. Chair, I'm going to pause here. That's the technical element. I'm going to hand over to Rechad, who will take us through the financials.
Thank you, CEO, and good afternoon. The table on the left side would indicate just the historical performance in terms of our fee income, indicating the growth in our own fee income generation compared to our cost of employment. And for the first time in 2022, our own fee income generation matches our cost of employment. In terms of the graph on the right-hand side, it's just comparing our fee income with our transfers received in terms of our operational grant. And for the first time, we saw our own fee income generation exceeding the grant received. We've seen quite a significant increase. If we look back to 2018, 2019, we were just able to generate 51 million per annum. It grew to 181 million in 21-22. And the main reason for the increase is mainly due to the newly gazetted fees in terms of the increases that we had, and also a significant number of applications received during the COVID-19 pandemic. In terms of how we utilize these additional revenues, is basically to reinvest it into our human resources to try to capacitate SAHPRA so that we can have a high turnover in terms of output of applications received. In terms of also the 21-22 financial year, we also have generated accounting surplus, which built up our reserves over the couple of financial years. Next slide, please. If you look at this table, it's indicating our revenue projections, looking at the past from 2021, then to 2023-24. Like I've indicated, we've seen quite a significant growth in terms of what we've also seen in the investment into our cost of employment. We've also seen an improvement in our turnaround times of applications received, which generated quite a large amount of own revenue for SAHPRA. The fee income that has been budgeted for the 23-24 financial year, we've just moderately increased by 5% based on our projections that we had. The conservative increase is mainly due to the expected plateauing of our revenue generation, as we will still need additional capacity to boost that revenues going forward. We are planning to publish a revised fee gazette during the 23-24 financial year to accommodate new revenue streams as well as current fee price adjustments. And the increased revenue that we do expect from this gazetting was not factored in the budget for 23-24, mainly expecting that impact to be felt in the outer MTEF period. Next slide. The graph here is just indicating our revenue per program over the past few years as well. The main driver, about 56% of our revenue, is generated by Program 2, which is mainly impacted by the product retention fees and new medicine registrations. And the new medicine registrations, what we saw in the 22-23 financial year, is the main driver of our increased revenue that we're seeing. Program 3 relates to the inspectorate unit. We've seen stable increases there as well, also where we have added additional capacity to the inspectorate unit. Program 4 relates to clinical trials, as well as post-registration amendments and biological testing. We do foresee a decline, a little bit of a decline in our clinical trial evaluations, mainly due to the COVID applications reducing over the NTEF period. Program 5 is the main contribution relates to medical device licenses and retention fees. Also a slight decrease expected, budgeted for in the new financial year, mainly because of the registrations of medical devices we expect only to commence late in the 23-24 financial year. Next slide. Our other revenue sources, referring to our transfer that we receive, you will see just a slight increase of 2% in the 23-24 financial year. This does not impact us that much due to our healthy own fee revenue generation that we've had. The backlog deferred revenue line, you will see a 0 for the 23-24 financial years because the project has been completed in the previous financial year, and no additional revenue is expected to be released from the deferred portions that we had, and it's all been resolved and cleared. We do have quite a significant amount of interest revenue that we've generated, especially in the 22-23 financial year. The March accounts indicates about 20.6 million rand, and that's mainly due to the healthy bank balance that we carry for SAHPRA on average throughout the year. It's for 22-23, it was about 375.6 million. It's mainly due to applicants paying on application to SAHPRA, and those funds can only be utilized when the revenue or when the services has been rendered in stages to recognize it as revenue. It also was quite high due to the high CPI increase, which boosted the deposits percentages that we have. For the 23-24 financial year, we took a bit of a conservative approach. We do expect a 15.7 million interest revenue generation based on an average interest rate of 3.372% on a projected bank balance of 469 million. It's mainly, we do expect that the CPI rates would normalize during this financial year, hence the lower percentage utilized in the calculation. Also, the additional cash balances that we have is deposited in the Corporation of Public Deposits, which is with the Reserve Bank as determined by the PFMA. Next slide. On the expenditure side, as indicated, you'll see the growth in our cost of employment, basically due to the drive to try to fill the vacancies that we have vacancies that we have compared to the approved structure, and the big jump of 26% from 210 million to 265 million is mainly impacted by the vacancies that we filled during the 22-23 financial year, where we feel the annualized impact of that vacancies that we filled. Also, National Treasury has approved a budget deficit of 13.9 million for the 23-24 financial year, which also helped us, or is also due to the increase of 26%, mainly because of trying to fill those additional vacancies, and this has been funded with the reserves that we've built up over the past 4 financial years. The next expenditure line under goods and services is office rentals. So we had to acquire additional office space for our border control activities that are related to port of entries, and also new or replacement regional offices in Durban and Cape Town. Backlog reduction project, the expenditure side of it also 0 because of the completion of the project. Contracted services relate to our agreement with National Control Laboratory function for the testing of biological products or vaccines, and the operating expenditure is mainly driven by the allocation for external experts for our evaluations, communications and ICT, outreach expenditure, travel, and as well as medicine testing, storage, and destruction. Next slide. The table here indicates our MTEF budget per program. It indicates also then the breakdown of compensation of employees and goods and services. and 66% of our budget has been allocated against our core programs, which are from Program 2 to Program 5, and 34% to the administration part of Program 1. And the main driver, basically, in terms of Program 1, is the support services, the communication costs, the ICT costs, the building costs is factored in there, entire goods and services there. The main cost drivers of the programs is compensation of employees. Just to note, the reduction in the goods and services from 22-23 to 23-24 in goods and services relates to the backlog expenditure we previously have incurred. And then from 23-24 onwards, you will see that reduction as the project has ended. Next slide. This is just then the MTEF budget estimates, or the estimates over the MTEF period. And you'll see there at the bottom just the 13.9 million in terms of the approved budget deficit from National Treasury to assist us with the vacancies. You'll also see, if you look at the 24-25 financial year, where we did indicate a higher expected revenue generation, own revenue generation, mainly due to the anticipated gazetting of fees. In terms of the above, in terms of the available funding of the outer years for the cost of employment, we'll see is a bit constrained as we are projecting our limitation, or our limitation in terms of what we can generate with our current capacity that we have. Next slide, please. So in terms of the key challenges and interventions, mainly from a budget perspective or funding perspective, is that as at 28 March, SAHPRA had 96 vacancies, mainly of highly skilled roles in pharmaceuticals and medical device product assessments. The estimated cost to fill these vacancies is approximately 76.4 million per annum, for which we currently do not have existing funding available. Significant year-on-year deferred revenue that we see, that's the high cash balances, is an indication of the inability of SAHPRA to timelessly process applications that we receive and recognize revenue due to the capacity constraints and to some extent inefficiencies in our SAHPRA manual processes, as we're not able to accommodate the large volumes of data. The digitization, therefore, is the digitization of processes, therefore, is a priority for us. The interventions that we've been implementing from the previous financial year is just to, again, additional revenues that we do generate, our own revenues. We invest in our cost of employment, trying to fill those vacancies, the critical vacancies. The National Treasury budget deficit also assists to help us fund some of our vacancies with that from our reserves. Also, National Treasury has approved our surpluses before, and we use that funding to digitize or use it for digitization of some of our processes. We also secured funding with Global Fund with additional financial support for human resources, which will assist us with increasing our revenue recognition. We have issued a tender for RIMS, the Regulatory Information Management System, in the fourth quarter of 22-23, and we hope to make an award early May or by end of April. And this will greatly enhance our efficiencies and assist us with tracking our workflows and applications received. Review of the current fee structure for additional and increased revenue streams, we're planning to issue in the 23-24 financial year so that we can get the full impact of that additional revenue generation in the 24-25 financial year. Thank you, CEO. Over to you.
Thank you. And Chair, just to conclude, to say that as a regulator, we continue to monitor COVID. We don't think we're out of the red yet. So we monitor, all the reports, as well as on our Mat Safety app, we continuously monitor any adverse events that are reported. And aligned to this, we continue to prioritize this area of COVID. Again, to keep up with the changing pace in terms of product innovation that we're seeing, the number of product applications that we are receiving, we have embarked on processes to re-engineer our business processes. And as Raghat said, digitizing our operations also is a big priority for us. We've been playing a very strong role at a continental level, but also international level. And one of the asks that we have of the portfolio committee is that there's a lot of developments pertaining to this agency. Quite soon, they will be appointing a board that will then be appointing the Director General. And for as long as this treaty is not ratified, South Africa cannot participate in any of these platforms. So we do ask the portfolio committee to please support, the ratification of the treaty. I understand that it's been signed, but it needs to be ratified. We are continuously requested and asked by the AU Commission to say where is South Africa when it comes to AMA, because they want us to participate. I mean, we're one of the strong regulators on the continent, and they do want to have a SAHPRA voice in the board and in all the various interventions that are being implemented through AMA. So, we are asking the committee to support this. Secondly, very much linked to the treaty, we have submitted an expression of interest to host the Vaccine Center of Excellence, considering that we are the one of the two that have ML3 for vaccines with an ML4 for lot release. We are well positioned to be hosts of this vaccine center of regional excellence. However, again, it is important then that our country does ratify the treaty for us to be, it will add really to our eligibility to hosting. And we've got, from a technical perspective, I think we've got all the makings to be successful. But this treaty is quite an important one to show South Africa's commitment to the continental efforts. So that's something that we are asking the committee to assist us with. And while we continue to focus on continental efforts, our role globally is also quite strong. We have a number of our assessors that assist WHO with their pre-qualification reviews. There's a lot of training that WHO is offering us, and they, are quite keen to see SAHPRA reach ML4 or be WHO listed. And as we do all of this, we will continue to focus on our core pillars, which is safety, quality, and efficacy. We do not consider anything else outside of these pillars. Thank you, Chair. We will then close here. Thank you.
Thank you very much, Dr. Semete, and your CFO for the presentation. Honorable members, I see only two hands. I see the hands of Honorable Gela and Honorable Wilson. Any others? We will go straight over at Dr. Chimbakwayo. In that order, please, honorable members.
Thank you very much, Chairperson. Let me welcome the presentation from SAHPRA. Indeed, we will support you as portfolio committee on AMA treat. I hope even other members will also support that. Coming to the challenges that you have as SAHPRA, we are noting them, hoping that you will address them as soon as possible, especially the one that speak about filling 96 vacancies of highly skilled. That one is very critical. We hope you'll get assistance and fill those posts. The questions, Chair, that I have, Chairperson, SAHPRA is set be drafting a new SAHPRA bill. Can they apprise the committee on what this new bill seek to achieve? The second question, Chair, SAHPRA implemented a public education campaign on advanced event following a vaccine. My third question, Chair, the role, actually what what role is SAHPRA playing in supporting a local, regional vaccine production? Lastly, Chair, can SAHPRA update us as a portfolio committee if Chairperson SAHPRA can SAHPRA update us, Chairperson, on some of the litigation cases against it that are still before the court? Coming to the budget, Chairperson, as it's been presented, Chair, especially on slide 20, we really appreciate the surplus, but also, Chair, my question is in terms of the budget. Why does program 1, leadership and support, receive the largest portion of the budget as opposed to other program 2 and 3, which deal with medicine registration and inspection, which are very key also, Chair? Those are my questions, Chair. Thank you for the opportunity, Chair.
Thank you, Chairperson, and thank you to Prof. Rees and to Ms. Sameti for the presentation. It is appreciated. I have a couple of questions. The first one is regarding the sharp decline in licenses finalized. How has the new business model been communicated to applicants, and how does this affect appeals? Why was lot release requests finalization changed from 30 days to 50 days? What is the current medicine registration backlog, and how long does it take on average to register a medicine? I think that's, that will help us on some issues. There seems to be a fairly fast staff turnover rate. How is this being addressed? And then just sort of off the line a little bit, SAHPRA is said to be drafting a new SAHPRA bill. What does this new bill seek to achieve? So we can prepare ourselves for that. With regards to the Cannabis Act, and you did mention this, perhaps you could update us a little bit as to what progress has been made there and where the bill stands currently. I think the increase of revenues is significant and pretty pleasing. More so because it has enabled additional staff and resourcing, which I think is important. However, this was followed by the 96 highly skilled vacancies, which is very alarming, particularly as you state that there is no funding despite the increases in your revenues. And particularly when it comes to such critical skills. And perhaps you could update us if these critical skills are actually on the critical skills list, or are such professionals available, but we just can't afford them at this stage. That's my questions, Chair. Thank
you. Thank you, Chairperson. I've got only 2 questions to ask. And the first one is based on the revision to the 2020-2021 to 2024 strategic plan that deals with the percentage of recommendation from the staff satisfaction survey implemented. I've noticed that only 40% of the recommendation from the staff satisfaction survey was implemented. So I just would like to know why is it such a less percentage? Because it's about the staff satisfaction that plays an important role, that boosts the morale of the staff to continue serving in your department. But for your department to only implement 40% of the recommendation, it's not looking good. So can I have the reason why is it at 40%? And just to put the record straight, to say, in pertaining to the request that you made to say, and it's even written in bold, to say you need us to support the World Health Organization treaty negotiations on the global accord agreement and so on. Just to say we cannot, from my own side or from my own political party, to say we won't support it. Even when they were here, the representative of the WHO, the time when they had a meeting with us, we made it clear that from our side, we won't be able to support that. There is an outcry about the signing of this treaty from the majority of the South Africans as it is. So we are in support of the community's outcry about this. So unfortunately, from our side, we won't be able to support that. Thank you.
Thank you very much, honorable members, for raising what you have raised with SAHPRA. I have a number of things to mention. First is the good stuff. Well, it's still an I hope that you're having an unqualified audit, but we know that you normally achieve those. So I'm really hoping that you achieve that target. And then secondly, I want to commend you on the fee income that you've been able to generate. We remember that it had been quite a bit of a challenge since we've been members of parliament since 2019. And towards 2021, 2022, you were beginning to equate your fee income with your cost of employment, which is outstanding. And then I noticed that your estimates, you estimated increased revenue for almost all of your programs. And I hope that that will really come true. But on your, and this has been raised by Honorable Biela, this point of local manufacturing. But I want to just put a bit of a twist to it. Do you actually support local manufacturing of whether it would be for pharmaceutical drugs, medical devices, diagnostics, other products? And what would their support be in terms of being able to expedite, of course, the applications of those who are from South Africa in terms of any of these and other products which you regulate? And secondly, on terms of your backlog reduction project, which you say is now completed, we remember that that was also a bit of a challenge. Let's call it an historical backlog for that matter. The question is whether now that you're saying that you have inadequate resources for evaluation of pharmaceuticals, whether that now lends itself to a new backlog being developing at the moment. Your challenge with drawing suitably qualified and skilled persons, and I understand that it should be quite difficult. And as you say, you also have to contest with the private sector, whether you actually are restricted in terms of the offerings which you can do. And I do hope that you are not, so that we are able to draw the necessary people for these positions so that you are able to perform better at the work that you're doing. Very lastly, just to differ with Honorable Chamber Kwayo on a statement that there's an outcry of the majority of South Africans in terms of the ARMA treaty. I don't agree with her. The ANC does not agree with her. We have the same presentation. The ANC supports this treaty. The Portfolio Committee, where we are a majority, will support this ratification of the AMA treaty. And we look forward to actually starting to deal with this matter once we have completed some other work. So handing back to you, Dr. Sameti, and to Professor Reeds and the team, we look forward to your responses. Thank you.
Thank you, Chair. I'll have my executive for finance comment, my executive for regulation comment, and the executive for HR comment, but I'll speak to some of these. So in terms of the SAHPRA bill, as I've said, we're not changing anything fundamental in terms of what SAHPRA offers. We are amending some sections of the Act to ensure that they are clearly understood and that they're current, but our mandate will remain to be safety, quality, and efficacy. So that remains to be. In terms of awareness for the public, as I've indicated, we've got a number of awareness campaigns in the form of webinars. We've done these infographics, and we continue to also participate in some of the conferences. And so those are some of the things that we've done. On local and regional production, I mean, our role as a regulator here, so while we can enable, because we do at a point where ahead of policing, the role of the regulator in local manufacturing could be limited. So what we've done in the various engagements that we're part of with the AU, and actually the AU will be is considering funding us to increase our capacity. They'll be coming in May for a DD, a due diligence process. And what we've put out is to say, as these manufacturers are advancing in terms of technology, we need to ensure that as a regulator, we've got the requisite skills to support that. So they'll be assisting us with that. But also from a lot release, we need to increase the footprint of the lab. We need more infrastructure. And then that's something else that they're looking at. And what we've done to support industry is, we engage with them quite regularly. So we've got an open, very open platform wherein if they have questions for us, they can utilize that before they make any submission. They can meet with us, tell us what their plans are, and we can advise them in terms of what is required. And that so far seems to be very helpful, because a number of them may not always be familiar with regulatory requirements and a regulatory pathway. I'll talk to the litigation cases. Yes, we do have quite a number. I think some you've seen in the media. There's one around the Pfizer vaccine by Liberty Health fighters. And that one, in essence, they had wanted to interdict the rollout of the Pfizer vaccine and also interdict the rollout to the high-risk pediatric population, and they were not successful. But the main court challenge of challenging the registration of the Pfizer vaccine, that's still ongoing, and we're happy to keep you updated whilst we can, but that's an ongoing one. There is one that's been making rounds in the media, but I must say that we have not been served with the court papers, neither ourselves nor the Department of Health. So the applicants have gone to the media, but they've not come to us. I'll comment on the AMA. When the honorable member spoke, it sounded like they're referring to a WHO treaty. And this one certainly is not a WHO treaty. This is the African Medicines Agency. This is a treaty around the establishment of an agency that will support health product registration in the continent. I understood when you were explaining it, it sounds like there's a different one. So we're happy to share details of clarity, because it is important that we're all on the same page. As I say, this is a treaty for establishment of this African Medicines Agency, and the WHO is not too involved in that one. I'll ask Rechad to comment, Portia to comment on the licenses, the lot release, the medicine backlog, and Gordon to comment on the staff turnover, vacancies, critical skills, and staff satisfaction. Oh, and if I can just comment on cannabis, yes, that we've made good progress. We do have, there's a project management office led of the presidency that's led by Dr. Garth Strachen. We've been having many engagements with them. There's some recommendations that have been made to SAHPRA that will enable access to industrial use of cannabis, particularly for a certain limit of THC. We're still considering the submission. We gave them feedback today, and we hope that as soon as we have finalized the review of the data and consulting with various stakeholders, we will be able to give give feedback. Thank you. Let me hand over to my colleagues.
Thank you, CEO. In terms of the question on program one, so program one carries about 34% of the total budget. And the main reason behind it is it supports four other functions, programs 2 to 5, and it centralized the costing for goods and services within that budget, where you'll see the communications, the ICT, the software, the digitization projects, the offices. So that's why it's carrying that load, but it's still basically a third of the budget, and the majority of the budget overall goes to the core function programs. And also, if you compare on slide 25, just the cost drivers for the other programs is cost of employment, and you'll see the movement between the budget and then for 22-23 versus the prior year. The increases are driven by that cost of employment elements for those programs. Thank you, Chair.
Thank you, Portia.
Thank you, CEO, and thank you, Chair. I will start with the question that relates to the adverse events following immunization training for the public. As SAHPRA, we receive the reports of these adverse events following immunization from the public and also from healthcare professionals. So we did conduct training of healthcare professionals, and also to ensure that we get complete reports as public can report straight to the regulator. We decided we needed to start training the public on this. So we'll be doing webinars in different provinces. And in actual fact, we have already started with training. And when it comes to the decline in the licenses finalized and on how do we intend addressing this, before a license can be issued, the site, the manufacturing site or wholesaler site or distributor needs to be inspected. So what we have seen is that with regards to the number of sites that needed to be inspected versus the human resource that we have, and also the timeline that it takes, we looked at increasing the resources, the number of inspectors, so that these new sites can be inspected, so that the license can be issued earlier. And what we've also observed is that in some cases, some new facilities will indicate that they are ready for inspections, and when we send our inspectors to go do the inspections, find that they are not ready in a way. And that really took into more of the time that when we calculate the time the license takes from the date of submission for the application until the site has been inspected, to be a bit longer. So what we also now decided to do was to re-engineer the process that talks to the inspectorate and also, the applicant manufacturer's readiness for inspection, and so that that can be taken into account. And when it comes to the issue of lot release, we have changed the target from 30 days to 50 days due to the fact that in some cases, the testing of the vaccines can take even between 4 to 6 weeks. And it's not within the 30-day timeline that we had previously. So based on the assessment and the analysis that we did, we saw it fit that in order for us to be able to work within the target, we need to amend that to 50 days, because the 30 days for those vaccines that needs to be tested and the test taking longer, more than 30 days, more than a month, those that goes up to 6 weeks will be a bit problematic. And I think, Chair, thank you very much, CEO. I'll stop here.
Thanks, Portia. Gordon?
Thank you, CEO. Good evening, honorable members. I'm going to talk to the staff turnover, how we address it. As an organization, the most important thing is to engage your employees, and the entire executive as well as the CEO. We engage all the employees on different matters, and we allow them to come up with possible solutions. And in addition to that, in terms of this engagement, we also communicate the way forward on things that we're going to do. For instance, we are working with organized labor in the new benchmarking exercise that we need to do. And it must be noted that SAHPRA employs the cream of the crop when it comes to the technical skills, but the private sector offers higher salaries than what we can afford. And it must be remembered that the DPSA salaries are public salaries, but we don't know the salaries of the private sector. Therefore, they can attract our employees much easier. And on the customer satisfaction percentage, at this moment, we're going to redo another customer employee satisfaction survey to determine how we have improved compared to previous years. But overall, it is a very interesting space in the sense that the private sector attracts our employees because they know how much we offer them. And at this moment, we are also developing a remuneration policy whereby with the benchmarking, we're trying to be able to remunerate as per the market. At this moment, I will stop there. Thank you very much.
Thanks, Gordon. Do you want to speak to the vacancies, the critical skills, and the staff satisfaction?
CEO, can I just take the hand of Dr. Chembakwaya? It might just be something that is same person to speak about. Dr. Chembakwaya?
Chairperson.
Yes.
Can you hear me?
Yes, we can hear you.
Chair, can you hear me?
Yes, we can hear you, Honorable Dr. Chembakwaya.
Okay, no, I just wanted to withdraw the comment that I made and to say we support the African medicine treaty there. Thank you.
Thank you very much. Please continue, Dr. Semete.
Thank you. I was just assisting the executive to say if he can talk to the staff satisfaction question, the one on critical skills and vacancies. You spoke to that staff turnover.
On the critical skills, we have the different kinds of training that are provided worldwide, and our employees are attending and get those skills, which makes them to be one of the best within South Africa, and therefore it's easy to get them recruited from the organization. And therefore what we do is to try to make sure that we look into the remuneration and see how we can correct whatever possible that we can do. But again, as I said, the foundation is the engagement with all the employees, and especially with the ones with the critical skills that we are losing as an organization. Thank you.
Thank you, Chair. That's our responses.
Thank you very much. I don't think there are any other points any members want to raise with you, Dr. Semete. I do not know whether Professor Rees is still busy.
I'm here with you. No, I'm still here.
You want to give some input, maybe a response, Professor Rees?
Yes, thank you. I first of all, with the and thank you for that endorsement of the African Medicines Agency. I would want to encourage Parliament and the Portfolio Committee to try and accelerate approval of this. You know, otherwise we are going to miss out on opportunities. We've heard that we can apply for the vaccines portfolio, and Dr. Semete is co-chairing one of the committees already, but it's a huge opportunity, and the African Medicines Agency is going to become very important. And if we're not there, we're not there. but we are being asked repeatedly, please, can we join? I think that there is a bit of a race through amidst African regulatory authorities, because as I said earlier, the stronger your regulatory authority, the more you are likely to attract investment in manufacturing, in clinical trials, etc. And that creates jobs and it creates investment money for the country. So if other countries leap ahead of us, get portfolios with AMA and so on, we would be left behind on that. The second thing is on the legislation. We will certainly come and talk to you, but I just wanted to reinforce the fact that this legislation is dated 1965, the original, and it's been sort of cut and pasted and band-aided and modified, and it's really not, it's fit for purpose, but you have to really go through a very circuitous process to sometimes to make sure that you're aligned with the legislation. But we will come back to you, but we have a really excellent team of advisors who are very knowledgeable on all. It's not just the medicines legislation, it's all of the related legislation around it that we are looking at. So for example, one of the important pieces of legislation that's being looked at now is with Department of Agriculture, because of what's called concerns about One Health. What we're worried about is what the impact is of animal health and well-being on human health and vice versa. And so it's very important that our legislation, while being suited for the veterinary sector, is actually not in any way harming the human sector. And at the moment, there are questions around that structure because it was developed many years ago. So we will come back to you on that. The third thing I would say from the board's point of view is that we share your concerns about human resources. We are in competition, as you heard, with the private sector, but there are two things that I think are very important. One is that we really have to increase the morale of the staff. And there's a very active set of work that's going on to do this, and a lot of engagement between organized labor, the executive team, and the board as a triumvirate to say, how do we do this? And that would be extremely important. But the second thing is that we do need to identify and find these highly skilled people, because it's that backlog that you picked up on to say, what is the backlog? You were asking these questions and Portia answered you. Part of that is that we need more people. We need more people to be inspectors. We need more people to look at manufacturing sites. And these are very skilled jobs. So I think we're obviously, as the board, looking at this and talking all the time with the executive team to say, how do we do this? And also, how are we going to fund those 96 posts? But it is a big priority for us. I'll stop there. Thank you.
Thank you very much. I think I'm going to allow Dr. Semeta just a closing remark, and then we are going to close our meeting, honorable members.
Thank you so much, honorable members. We certainly appreciate the time that you've given us, and also accommodating the request and the time change. These sessions with yourselves are always very helpful. You ask us the questions that sometimes we don't think about. So we certainly do appreciate this, and we look forward to coming back to you later on this year to share our performance for 2023. And thanks for the support.
It's a pleasure. Honorable members, we are done for the day. Just please be reminded that the SAMRC meeting takes place at 1400 hours tomorrow. It is not scheduled for 1700 hours anymore. It's at 1400 hours, and we're looking forward to the presentation too. That brings us to the end of our meeting for today. Thank you very much, honorable members, all the presenters, all of those who have joined us today. Have a good night. Thank you.
Thank you very much. Bye-bye.
Thank you, Chair.
Thank you, Chair.
Thank you.
Thank you.
Bye.
Bye-bye.
Thank you. Bye-bye.
Thanks. Bye-bye.
Recording stopped.